Hey Aeroflow Sleep followers, it's Megan, your marketing coordinator for Aeroflow Sleep. I'm back with Dr. Weiss for another segment of Weiss Words, and we have a very interesting topic for you today. It's a question that a lot of people are asking right now. Why should I use a CPAP when I could just get a surgery? Dr. Weiss, what's the difference? Is one better than the other?
Hi, Megan. Hi, everybody. Good to be with you all again. So, Megan, this question is been all over the place lately, right? So it's so difficult to wear a CPAP mask. Should I just have surgery? So the thing is, not everybody qualifies for surgery, right? So the first thing about surgery is that there are different types of surgeries. There are some surgeries that are gonna look at your neck size, and some surgeries that are gonna look how your mouth and throat are. So from those, they want to make sure that they can increase the airflow that is coming from your mouth and your throat by opening some places inside of your mouth and some places inside of your throat. So not everybody's going to qualify for that type of surgery. The other part of surgery is that there's some new devices out there that can make some connections with the muscles in your throat and make sure that they're going to stay open during the night. But again, not everybody qualify for that. They're going to look at your body weight. They're going to look at your neck structure. So not everybody qualify for that. And I think the most important thing is that surgeries are something that is not definitive. So as much as we think that you're going to have a surgery is going to have your problem completely solved, if you gain weight or if something changes in your medical condition, then you might need to wear a CPAP even after having the surgery. So yeah, so you might need to have a CPAP even though you had surgery.
So I imagine that, when you have a surgery too, that's pretty invasive stuff. Using a CPAP machine isn't nearly as invasive, right?
You're absolutely right, Megan. So surgery includes not just the procedure, but recovering from the procedure, having anesthesia for that. So it's a very invasive procedure to be done. While the CPAP mask, you have more control and you work with your physician and with your doctor to make sure that you have the right mask and the right pressure to make sure that your mask is adequate for you.
Absolutely. And yes, that makes perfect sense. I actually have a CPAP mask here as well. And this is the most invasive one that I've ever seen. It's just a nasal pillow. And what you do is you insert it into your nostrils here like that. That's a whole lot easier to me than ever having to go in and cut your throat open or, move some things around and open up airways into your jaw or into your mouth. I can't imagine that, A, that feels very good, and B, that's really going to solve the issue and prevent you from having to use this every day anyway.
Yeah. And I have a mask here too. Just to show that it's I think that looking for a practical standpoint, you can have something that you can use every night and you can take it out and go about your day. While if you have a surgery, you're gonna have the consequences of that for everything that you do for the rest of your life.
Yes, let's not have to deal with that for the rest of our lives, y'all. CPAP therapy, of course, is going to help you every single night. So it is something that you have to work on, and sleep apnea doesn't go away overnight. But again, this is the better solution. CPAP is the gold standard for sleep apnea. I would advise, and Dr. Weiss would advise, not trying to go for a surgery. Until next time, though, we're going to talk to y'all later and see you on our next segment of Weiss Words.
See you next time.
Bye, y'all.